Okay. And still housekeeping issues here. Just ask that everyone mute right now, and if you do have a question, go ahead and unmute, or you can use the chat feature to bring up a question, and I'll make Rob know that you've got a question. So let me bring up the presentation here. Can you guys see can you guys see that? Okay. Okay,
perfect.
Okay, go ahead.
Thanks, Chris. And then, yeah, as I'm going through this, if you want, you can go ahead and put our emails on. So folks, again, first of all, thanks for attending. What this presentation should be really is a review of the original CPP communication that we did back in February of this year. And the reason why we're doing this is to make sure that everybody continues to drive the Cal OSHA requirements of a CPP, but with some minor changes. And what those minor changes they did was they, if many of you are aware that back in June of this year, they did a revised ETS, and really why they did the revised emergency temporary standard, ETS, is basically because as most people started becoming vaccinated, they realized that they can go ahead and loosen up some of the requirements that were originally put in the November 2020 emergency temporary standard, which required that businesses have a CPP, a COVID prevention plan. And if you remember, or some of you recall, in my last presentation I did back in February, what is a CPP? CPP is really a blueprint that businesses need to have to make sure that they are mitigating exposure of COVID-19. And really, what the CPP did was it was a derivative of the IIPP. So just like some of you are aware of an IIPP, an injury illness prevention plan, your IIPP is like a blueprint of your overall safety program. So what they said was, you know what, we want to make sure that businesses in California have a blueprint for COVID prevention. And they really did mirror the IIPP. There's many elements that you have in a CPP that are similar to elements you would have in an IIPP. So in an IIPP, for example, you have things like hazard identification and hazard correction. Those are actual elements you have in an IIPP. Well, CPP also has similar elements. So the first thing I'll say is that if you don't have a CPP and you have employees that are actually working and they're not completely remote, then make sure you have a CPP. And if you don't, that's why I told Chris, I said, let's make sure that you reach out to your risk management consultants at BBSI and ensure that we get a CPP to you and that it is being implemented and executed immediately. And I'll tell you why this is important, because in this last, I would say almost a year, and Chris can attest to this, as well as some other maybe even clients on this, but there's been huge fines related to CPP. When you talk to Cal OSHA, and we're constantly meeting with Cal OSHA leadership, in conferences or meetings and things like that, and they always talk about what their mandates are for the year. And in Cal OSHA's mandates, things like an IIPP, execution, key prevention, but also CPP right now. And companies are seeing fines of $30,000, $40,000, $50,000 right? For not having CPP in place as well as executing on that CPP. So again, I cannot stress this. If you don't have a CPP in place, please make sure you have one. And in fact, what we're going to do is in a little bit here, we'll share what that model CPP looks like, because what you can really do is just get it from the Cal OSHA website, or we'll go in and send it to you, and you just fill that out with our assistance. Okay. So as I mentioned, there's a number of different things that you have in a CPP, elements that you need to ensure conformance or compliance. Okay, next slide, please. So one of the first things you have to have or do in your CPP is make sure that you actually document that you've assessed your workplace and you've identified areas where your employees can potentially be exposed. So how does that work? Well, if you, for example, are just in a manufacturing plant, you know, I know one of our clients, they're a plastic manufacturer. You literally have this one employee site they go to. Well, in your appendix, and we'll show you this here in a second, in your appendix, what you basically do is just list down, you know, manufacturing plant. And that's where you'll say that, you know, your employees are exposed to or potentially have exposure to COVID-19. However, if you're a construction company and you go to different job sites, multiple job sites, you might put in your hazard identification sheet that, you know, you have XYZ job sites that employees go to where there can be potential exposure. If you're working with clients, let's say you're a plumbing company, right? You're going to put in there that, you know, customer job sites for plumbing operations, right? That's something that you might actually put in there as far as what you would say that your employees are exposed to, okay? So one of the first things you have to do is you have to go ahead and do an identification, evaluation, correction of COVID hazards, and you have those forms in your CPP. Next slide. Employee screening requirements, okay? These still have not changed. So when we talk about the revised ETS, these revised ETSs, as I mentioned, came about in June 2021. And really there weren't major changes except for a couple, which were face coverings as well as social distancing. So the employee screening requirements didn't change, right? You still have to make sure that your employees are doing some, or your operations are doing some sort of screening. Now that can be something as simple as ensuring that employees know that if they have symptoms of COVID, things like 100.4 degree temperature, coughing, sneezing, all the various symptoms that come with COVID, that they should know, they should contact you and say, hey, look, you know what, I've got these COVID-19 symptoms and I'm not going to come to work. So you don't necessarily have to have a formal documented process, but you should at least have a process that you can go ahead and demonstrate to Cal OSHA that this is how we self-screen. So I know for example, in our office, at the BBSI office over here, we actually had a thermometer, and people came in and they checked their temperature to determine if it is, over 100.4 degrees. That's not required. If you do decide to use a thermometer, you want to make sure it's a non-contact thermometer. You want to make sure that, people are wearing their mask and things like that, but you want to make sure that you're doing it in a safe way. You can also use questionnaires. So for example, if people come in, you might have a questionnaire, and you probably see this as you're going to different stores and things like that. If you are exhibiting these symptoms of COVID-19, please do not come into the building. Okay, so you can use various methods of self-screening or screening that would be in compliance. And as I mentioned, you can even use posters and signs. Okay, next slide, please. All right, so this is really one of the major changes in the revised ETS. And really what it comes down to is that we're going to talk a little bit more in detail about vaccines, but fully vaccinated employees without symptoms do not need to be tested or quarantined after close contact with COVID-19 cases unless they have symptoms. right? So because again, what they realized was that as people got vaccinated, the likelihood of severe illness or even transmission of COVID was minimized. So what they decided to do was change the regulation so that if you were vaccinated, you weren't required to be tested or quarantined as compared to non-vaccinated employees, okay, that were required to be quarantined or tested. And we have this situation occur quite frequently, to be honest with you, with our client base, where people call us and say, hey, you know what, the employee tested positive for COVID. And so, okay, great. You know, are they vaccinated? Yes. Well, then it's up to them. You know, it's up to you if it's up to the employee to say, yeah, you know what, I don't want to be tested or I don't want to be quarantined. I can continue to work. Okay. Next slide, please. So I'm going to go through some of these things here because these are really a lot of the questions that come up with the revised emergency temporary standard that occurred in June of 2021 here. So is documentation required for a fully vaccinated employee to work without a face covering indoors? Yes, vaccination status must be documented. So if you don't have a documented vaccination status process, then please ensure you have one. Again, you can work with our risk management team, you can work with your HR consultants, but Santa Clara County actually developed a self-attestation form that had to be put in place. So most of you, I think, are part of Santa Clara County. So if you don't have that form, let us know, because that is actually something you need to be doing is documenting vaccination status. Okay. Employees provide proof of vaccination, whether it's through a vaccination card, image of vaccine card, or healthcare documentation showing vaccination. The employees have to provide record of the vaccination status, and then employees can self-attest to vaccination status. Keep in mind that employees that refuse to attest whether or not they were vaccinated or not vaccinated basically means they weren't vaccinated. Okay, so them not offering their status basically means that they're not vaccinated. Next slide, please. As I mentioned here, again, under the ETS, an employer is not obligated to require employees to submit proof of being fully vaccinated. Absence of such requirement, employee has the right to decline. In that case, the employer must treat the employee as unvaccinated and must not take disciplinary or discriminatory action against the employee. So again, the key point there is you can't retaliate against the employee for not providing that. Okay, so this is another change to the revised ETS. In the original ETS, social distancing was required in the workplace. Under the new ETS, so again, just going back here to the original ETS, so if you remember in the past, you know, you have to ensure 6 feet of physical distancing to the best extent possible, encouraging tele-remote work, reducing capacity employees, you know, using visual cues, floor stickers, tape signs, all those things, even partitions, okay? Basically, originally, if you could not do any of these things where you could not social distance, you actually have to put partitions in place to ensure that there were safe spaces available for employees. Under the new ETS, next slide, please. Okay, there's no physical distancing required, okay? And it's up to you to evaluate whether it's necessary to implement physical distancing if you have 3 or more cases, which constitutes an outbreak. If you have 20 or more cases, okay, you actually must implement physical distancing and barriers. So again, At 3 or more, you should consider whether or not you might want to incorporate physical distancing requirements, including partitions, or if you have 20 more, you do have to go ahead and put in the social distancing or the physical distancing requirements. Okay. So this is now getting tricky, face coverings. The reason why it's tricky, folks, is because, and Janice and I were just talking about this earlier, you know, you have all these different regulatory bodies that are communicating what the requirements are, you know, for COVID prevention. So you've got CDPH, the California Department of Public Health, right? You got CDC, Center for Disease Control. Then you've got your various local county ordinances. So for example, Santa Clara County Department of Public Health, Alameda County Department of Public Health, you know, name it. And each of these different bodies keep coming up with their own requirements. So it's hard to say, you know, which is which, or basically who to follow. When in essence, you're really supposed to be following all of them. So Cal OSHA, when they revised their ETS in June, they said, hey, you know, we're going to allow that vaccinated employees don't need to have face coverings. So if you remember the original ETS in November, okay, face coverings were required by everybody, just like it says here in the slide, you know, and employers have to provide them. They're required indoors. They're outdoors. They're required outdoors when you're, you know, less than 6 feet away. Facials were not an option. Okay, and then you had exceptions. And those exceptions are there as you see them, right? When you're alone in a room, as I am right now, you know, so I have to have my face covering on. You know, the eating, drinking, you know, as long as they're 6 feet apart, using respirators, or they have certain medical conditions that would prohibit them or cause them, you know, more harm if they were to wear a face cover. So then in the revised ETS, Emergency Temporary Standard, in June, next slide, please. They said, well, now that people are getting vaccinated, no face coverings were required outdoors, except during outbreaks, regardless of vaccination status. So that was the first change. And then the second change was that employers may allow fully vaccinated employees not to wear face coverings indoors, but must document their vaccination status. So that goes back to what I said originally. You have to have an attestation process, right? A vaccination documentation process. And again, if you don't have one, please make sure you have that in place. It's required. If you need the form, email us and we'll get you that self-attestation form that you need. So there are some exceptions where California Department of Public Health requires face coverings indoors and outdoors, irrespective of vaccination status. And that's mainly in like school settings, healthcare settings and things like that, but I won't get into that. Now, even though Cal OSHA says that fully vaccinated employees do not need to wear face coverings, what currently does Santa Clara Department of Public Health require? Right? Which is that all indoor places still require masks. Here's a caveat though. The October 7th, and Chris, can you do me a favor? Can you, that link I gave you, can you put that in the chat, please?
Yeah, I'll go ahead and do that now.
Okay. So there was an October 7th update in the Santa Clara Department of Public Health website that stated that certain counties, like Santa Clara County, like Alameda, like Contra Costa, Sonoma, I believe, because there's been a downtrend, we'll have the ability to, based on certain criteria, remove the indoor masking requirements that were established back in August. And one of them was that if the county itself maintained a yellow tier for 3 weeks, and then they saw a downtrend and things like that. So it appears that potentially soon, some of these counties might actually remove the indoor masking requirement. Because again, it contradicts, right? Right now, Cal OSHA says fully vaccinated employees don't have to wear masks. But at the same time, Santa Clara County Department of Health says, no, irrespective of vaccination status, you have to wear a mask. And until we know absolutely for certain that Santa Clara County or these other counties have removed the indoor mask requirements, okay, go ahead and continue to mandate the indoor mask requirements. It does look, and Chris sent you that link that if you want to read that October 7th news press release, it's pretty clear in terms of what the criteria are, right? But I wouldn't go ahead and take any action until these counties have actually stated that, yeah, they are removing these indoor masking requirements. We'll stay on top of it. And in fact, what we'll do is once we are certain, okay, and we do see that in those county websites, we'll also go ahead and send out emails from our various business units that support you. As you know, each of you, are supported by a team at BBSI, whether it's your business partner, like I know Bob Min is on this call, is on this presentation today. So whether it's Bob Min and his team, whether it's our HRCs, our HR consultants, or whether it's our risk management consultants, or even our payroll consultants, we'll make sure that we are keeping everybody up to speed in terms of any changes from the different county requirements. Okay. So this gets a little bit confusing, like I said, because the regulation says one thing, but then the Department of Public Health says another thing, and we have to go with the most stringent. Right, next slide, please. Again, this is just, reiteration, face coverings are required indoors for vehicles for unvaccinated employees, right? So for those people that are unvaccinated, and remember, those who do not self-attest or decide not to go ahead and divulge whether they're vaccinated or unvaccinated, treat them as unvaccinated. They still have to wear face coverings. And then, as I mentioned earlier too, there are certain settings like educational facilities, public transit units, long-term healthcare facilities, correctional facilities that still have to wear masks irrespective of vaccination status or not. Okay, next slide, please. We went through this. So again, what are the exceptions in terms of wearing face coverings, when you're alone in a room or vehicle, eating, drinking? And again, this is also still the exception to the indoor county requirements too. So, again, like right now I'm in a room, in a conference room, I'm alone and there's nobody around me. So I can go ahead and not have my mask on. Okay. Next slide, please. This is part of your CPP. And again, we talk about the various elements, right, folks? So this is one of the elements, and you have to ensure this did not change. This was part of the original ETS. So you have to make sure that you do have cleaning and disinfecting procedures in place. Now, whether that's you're working in a business complex and you've got cleaning companies that come in and do it once a day, twice a day, whatever it is, that's fine, right? But you need to ensure that you can document or provide some sort of proof that you have cleaning disinfecting procedures, especially if you've had an actual case. And what I mean by that is that if you've had a COVID case, you need to be able to document that you went in there. I'm going to go a little bit for, I'm kind of moving forward here, but you need to be able to document that that person or those individuals that got infected with COVID-19, wherever they were, the surface areas that they potentially touched or were around, you need to document that you had, very good cleaning disinfecting procedures in place. Now, does that mean you have to hire a third party? You've got to go out and pay, I don't know, $500,000, whatever it is, to somebody come in and do official cleaning? No, it doesn't. Nowhere in the regulation, nowhere in CDPH, nowhere in CDC even. And believe me, folks like Chris and myself, we've combed every one of those regulations. Nowhere does it say you actually have to have a third party, professional cleaner come in. But as long as you've done it in a due diligence fashion, meaning, right, cleaning with chemicals that would go ahead and properly clean the virus, so such as Lysol, right? Or other cleaning agents with bleach in it and things like that, that would go ahead and properly disinfect and clean those surfaces that these employees were around and working. But again, you have to document it. You have to make sure that at any moment, if an employee comes and says, hey, you know what, did you guys clean? Yes, we cleaned. This is how we did it. This is the time we cleaned. And to be honest with you, I wouldn't even take pictures of it. If you were the one to do the cleaning, or your employees, or you personally, whatever it is, show through pictures that you actually clean. Show the chemicals that you use. Show the bottle of Lysol or whatever it is that you use, that you went in and you effectively cleaned the areas that those individuals were around. Okay? Or again, if you want to use a third party to come in, great, do it, and make sure, but that again, that they're using effective cleaning chemicals, right? Going back, and make sure, of course, you have SDSs and all those things that, risk managers like myself, and we want to make sure that you're using safe chemical cleaning procedures, where wearing your gloves, wearing masks and things like that. Make sure you're doing it safely too. Okay. Another element of your CPP, again, that hasn't changed in the revised ETS is ensuring that you've got hand washing facilities. I'm going to take a left turn here real quick. As an ex-healthcare provider myself, I'll say this. I always talk about the best way to really prevent COVID is making sure, right, that we're constantly washing our hands. I always tell my children this, to make sure that they're never putting their hands, in their nose or their mouth or their eyes and things like that. Think about, how COVID or any sort of virus or infectious material is transmitted to the body. Chris and I and Joe and Austin, the risk managers, we do this type of training for bloodborne pathogens. So this virus is similar to any other bloodborne pathogen, or what we call other potential infection material. So the key thing is when you have a virus, think about every day, you might be at a gas station, you might be going to a convenience store, to a grocery store, to go pick up your kids from school. Everything you touch, folks, potentially has, a virus on it, potentially even COVID, has bacteria. So it doesn't matter if it's COVID or what, it could be anything. It could be the flu virus. So the key thing is, well, how do you get into your system, right? So with COVID, of course, we know that it could be, airborne. So if somebody coughs or sneezes and we happen to breathe that, especially within 6 feet, yes, we can go ahead and inhale it and it gets into our body system. So that's one way to get it. The other way to get it, right, is through putting it into your body system through contact. So if I touch something and then all of a sudden it's got COVID or any other flu virus or whatever it is, and next thing you know, I happen to stick my hand, how many times a day do we accidentally put our hands in our mouth, or we might rub our nose? Well, then at that point, it can get in your system. So one of the best ways to prevent COVID is understanding how it gets into your body and prevent the ways that would, whether it's making sure, again, you're maintaining safe distances from people who cough or sneeze, wearing a mask, of course, and ensuring that all the different things you're serving, you're constantly washing your hands, you're making sure that knowing that at any moment you can have, hundreds or thousands of viruses that you could potentially come in contact with on a daily basis and get into your system. So sorry about that little rant, but I think it's really important to understand, how really the virus gets into your system and how you can prevent it. Okay. So the requirement is, of course, at the workplaces that you have the ability for employees to wash their hands and ensure that you've got hand sanitizers available too. And those are still in place and those are still required. Okay. PPE again means personal protective equipment. So as you know, in this case, what we're talking about is really masks. Okay, and you want to make sure that you have the availability to go ahead and provide PPE to your employees if necessary. If they don't have masks, you want to make sure that they, potentially at your entrance or at the reception table, wherever it is, you have the ability to go ahead and give not only the employees, but also your clients or your customers masks too. That's a good idea. Okay. All right. Responding to COVID-19 cases in the workplace. So we talked about this in length in February, but when you do have a case in the workplace, there's a number of different things you have to do, but the most important thing, right, is ensure that you remove the infected person or the persons, right, and you get them quarantined. But again, the exception now is if they're vaccinated, they don't necessarily have to be quarantined or even tested for that matter. But if they're not vaccinated, then yes, they have to be tested or quarantined. And you want to make sure that when you do the testing, it's at no cost to the employees. Very, very important. Okay, and it can be done during business hours too. You also want to make sure that through various methods, and we have forms, folks, if you need, if you have these situations, there's sample notification forms to not only contractors, to employees who came into contact, or employees that were not even contacted but were around. So you have to make a notification to your entire operation that you had an individual that has been tested positive with COVID-19. You want to make sure that you never ever divulge the person's name. Again, now you're crossing HIPAA regulations or violating HIPAA regulations, should I say? And you want to make sure that you leave the names off. You leave details, but you're basically letting a number of different parties know of the fact that you had a positive COVID case in the workplace. And there are different demographics you have to notify. Okay. So one demographic is folks that have what we consider close contact, who've been exposed. And the definition for exposed is, if you remember me talking about this last time, where you were within 6 feet of that person, within a 24-hour period of knowing of that person being exposed, you were within 6 feet of a person for more than 15 minutes. So for example, if I got COVID and I said, well, yeah, man, I had COVID, and I came to know that I had COVID today, and Chris happened to be with me, even if he had a mask on, right? If Chris happened to be with me for more than 15 minutes within 6 feet, then that's what we call exposed. So we also have to notify Chris separately that, hey, look, you know what? You're somebody that came in contact with Rob Singh for more than 50 minutes, and you're less than 6 feet apart. So you have the option of getting tested. Now, if Chris said, well, I'm vaccinated, I'm okay. All right, great. You don't have to. But if you're unvaccinated, we want to make sure that we certainly give Chris the opportunity to get tested and quarantined too. Okay. We talk about the cleaning and disinfecting processes. If it's a, if you have a case, irrespective, folks, if you think if it's non-work related, okay, but they notified you at work, and that person got hospitalized for more than 24 hours, or God forbid there was a death, right? You have to notify OSHA. And what I will say is just make sure you work with your risk management consultant, myself, Chris, Austin, or Joe, to help you with that. We've had situations, unfortunately, within a client base where there has been fatalities from people. And even though we knew that they're potentially non-industrial, we still have to notify Cal OSHA. And I'll be honest with you, what Cal OSHA does is, even though they might think, yes, it is non-industrial, they will still go into your workplace and they will ensure that you do have this CPP in place. You're doing all the different things you need to be to ensure to you're preventing COVID-19. Okay. Real quickly on the reporting protocols, it used to be, if you remember last year, where you literally had to report every case to the County Department of Public Health. Now it's changed a little bit, where if you have more or less an outbreak of 3 or more, then at that point you have to report it to the County Department of Public Health, whether it's Santa Clara County, Alameda, and things like that. But again, things can change on a daily basis. So just be on top. One of my recommendations is whatever county you're at, whether it's Alameda, Santa Clara, Contra Costa, it doesn't matter, Santa Cruz, constantly check your County Department of Public Health website. And there's a business section there, or it says, it says employers, and check out those links to ensure that you are doing everything you possibly can as an employer. All right, next slide, please. Yep. Just things like, when you're communicating these cases and things like that, be respectful. You can have a designated person in the office that's responsible for all these things. So for example, even at our BBSI office here in San Jose, we have designated individuals that are responsible for ensuring that all the things that are required for communication, notification, things like that for all the employees that were exposed or non-exposed. We're doing that, and so you got a point of contact. So it's not basically just kind of a random process, but it's a very, very streamlined, structured process that maybe 1 or 2 people are responsible for. Okay. Next slide, please. Now, this is important. This is part of your CPP, and it didn't change in the revised ETS for June. However, you still have to make sure that everybody in your operations is trained on the CPP and the elements of all the CPP, that things like all the different things we talked about. Make sure it's documented. So right now what we're seeing is that folks might have a CPP in place, but none of their employees were trained, and OSHA's hitting them with $10, $12, $15,000 fines because, yeah, okay, you've got this CPP, it's great, but it's not implemented, it's not executed, right? I was just at a site not too long ago, it was like a couple of weeks ago, where OSHA was doing an inspection on the site, and they were literally looking at the tools to ensure that, tools were not being shared, that, if you had your own, I think it was some carpentry tools. We were at a construction site, and they ensured that, hey, you know what, are these folks actually sharing tools, or are the folks, making sure that they're cleaning and disinfecting the tools and things like that. So they look at even specific things like that to ensure that you're not spreading COVID-19. Okay. All right. So for the exclusion cases and things like that, it's important to understand that there are different criteria. And Chris, if you want, let's go to the next slide, because I'm going to talk about really the specifics of the new regulation. So if you had close contact, right, you have return to work guidelines that are supposed to be met, except for fully vaccinated employees. And what are those return to work guidelines? Next slide, please. Okay, here they are. So once you have a case and you quarantine these individuals, you have to give them at least 10 days, okay, to be quarantined and ensure that they have no symptoms. In addition to that, you have to make sure that at least 24 hours have passed without no temperature of 100.4 degrees. Okay, so again, positive cases with symptoms, those three things have to be met before they come back to work. Positive cases without symptoms, you still have to make sure that you give them 10 days, okay, and that 10 days have passed after a positive test. So if for example, let's say I tested positive today, I need to make sure that even if I didn't have any symptoms, I still need to ensure that that person was removed from the workplace. Again, unvaccinated folks, please remember, unvaccinated employees, that person was removed from the workplace for at least 10 days. Okay, and again, if you have symptoms, you want to make sure that those other cases, those other things are no longer in place, such as the temperature, and that there's no symptoms. This is important. You cannot require an employee to show a negative test result for the employee to return to work. You cannot say, "Hey, look, Rob, I need to see a negative test before you come back to work." You can't do that. Okay. All right. A lot of information here. Chris, can you do me a favor? Can you pull up the actual BBSI CPP?
Yeah, well, hold on.
And real quick, folks, as Chris does that, keep in mind that when you do have those individuals that are testing positive and you've quarantined them, you have to ensure that you still provide them wages. You still have to pay them. Okay. And now we have FFCRA that I know expired in September. However, the regulation, again, you've got FFCRA, but then you also have the regulation itself. Right. And in fact, what I'm going to do.
You see the program?
Yeah,
Rob?
I see the program. Perfect. Thank you, Chris. I'm going to read to you. I think this is important. Okay, in the actual regulation here. And again, talk to your RMC, and specifically your HRC on this too. For further guidance. Okay, don't take a shotgun approach to this, but this is a question that does come about, and there's some confusion about this. So again, this is per the regulation here. For employees excluded from work under the CCR 3205, employers shall continue to maintain employees' earnings, wages, seniority, and all other employee rights and benefits, including the employee's rights to the former job status, as if the employee had not been removed from their job. Employers may use employer-provided employee sick leave for this purpose to the extent permitted by law. Wages due under this subsection are subject to existing wage payment obligations and must be paid at the employee's regular rate of pay no later than the regular pay date for the pay periods in which the employee is excluded. Unpaid wages owed under this subsection are subject to enforcement through procedures available in existing law. So there's a lot of confusion about, do I pay them or not? This is the law. This is the actual California Code Regulations 3205. This is what it says here. And again, I know I read this, and it was very technical, but I want everybody to understand, right, that we are obligated to ensure that during that exclusion period, okay, we do have an obligation to ensure compensation. But again, work with your HRC on this. When you do have
Rob, I'll just add one thing. If you keep reading, there are exclusions to that. And one of the exclusions is that under the, if it is a work-related exposure, you have to pay under exclusion pay, and that's what you're referring to.
Yeah.
So, yeah.
Yeah. All right, so again, we want to make sure that we include that, but work with your HRC when you have those situations, and that we can go ahead and guide you correctly, okay? As compared to just saying, no, look, you know, you're not gonna pay them at all, because then, you know, it's pretty gray, because you might have situations where you have to, situations where you might not have to. But let's make sure that you're doing the right thing, okay? All right, folks, what you have here, right, is the plan that you should have in place or should have had in place. If you don't, let us know, email us, and we'll make sure that we provide you with this model template. And I'm okay with sharing our model, our CPP with you, because it's ours, is BBSI's. But really what this is really the actual plan itself that you get from Cal OSHA, and that Cal OSHA wants you to have filled in. So everything that we just went through in the presentation in terms of all the elements are right here. Cal OSHA really just gives you exactly what they want you to do. So it's, again, like an IIPP. Let's say Cal OSHA gave you a model IIPP, you just fill in the blanks in terms of some of the specifics, right? And there might be certain things that you do that go beyond, you know, what's required, but that's where you can go ahead. This is the document, you can go ahead and put that in. So this is the model CPP template that Cal OSHA as well as BBSI provides you. And if you look at this, it goes through all the different various elements we talked about, from employee screening. And, you know, on the top where it says, this is how we're going to go ahead and screen. And you might put in there, well, we are going to have employees self-screen and to ensure that prior to coming to work, they understand that they have the COVID-19 symptoms, you know, listed as boom, 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 that they kind of come to work. Or you might have a screening method that includes a thermometer. And you might put that in there on the top saying, you know, our screening method includes a non-contact thermometer, you know, that will demonstrate if you have a fever or not. You know, or our screening method involves not only signs and posters, but also questionnaire. So again, you would put that in the first section in terms of employee screening. Okay. So as Chris goes through this, Chris, do me a favor, just go back up to right there, the appendixes. Okay. So if you remember, one of the things I said, the first thing you have to do is you have to make sure that you put in the areas where you potentially might have, where employees might be exposed. So this is where you would fill it out, okay? And again, it's pretty self-explanatory. You basically just say, you know what, these are, you know, you could be a manufacturing plant, you could be a restaurant, you could be a construction company. You say, you know, customer job sites or a construction site, you know, and then, you know, you're going to put in there things that, you know, you're doing in terms of controls, whether it's, you know, ensuring social distancing or ensuring, you know, face masks or whatever, things like that, okay? Keep going, Chris, please. Okay. This is something you also have to do. Again, we talked about this, but you want to make sure that you are, you know, doing an actual assessment of the workplace. So you've identified areas where people potentially may be exposed to COVID based on operation, whether you're a single work area location, like a manufacturing plant, or whether you have multiple job sites, and that was Appendix B, I'm sorry, Appendix A, but then Appendix B talks about, okay, great. Now that you've identified, okay, those areas, have you done your due diligence to ensure that you've done an inspection of those areas and provided controls to ensure or minimize COVID outbreaks? Okay, so for example, are you doing surface cleaning, disinfecting procedures? You know, are they in place? And you would say yes. done on a daily basis or what have you. Okay. So these things have to be filled out. These forms do have to be filled out, and OSHA will look at them. Okay. And then these are the sample notifications and things like that. You do have to go ahead and document, right? The fact that you did go through your notification procedures, and that was Appendix C, and you have to actually put in there whom you notified and who was exposed and things like that. But again, this document, right, making sure that you're completing it fully. So this is an example.
There is a question in the chat. Deborah's asking, can you provide a quick reference of vaccinated and unvaccinated rules when they have symptoms, when they say they may have been exposed elsewhere, when they are exposed at work, specifically when they can come back to work for each scenario, if they need to be paged, such as work exposure, I believe you're trying to say.
And you said as well, Deborah?
Yeah.
I was wondering if you had like a single sheet, like a quick reference to have a quick glance, so that we can kind of know where to start.
So Deborah, for example, like you're talking about if more like a decision chart, right?
Correct.
Okay.
Yeah.
Okay. Yeah. You know what we'll do is kind of even take what we have a little bit on the slide, because that slide itself has a little bit of a decision flow chart on it, where it talks about, if the employee is vaccinated, then they can do X, Y, Z.
So Rob, let me add one thing to that. Hi, Deborah. One thing is that you have to remember is that there's also city rules. So Rob is specifically referring to Cal OSHA and the ETS, but every city also has rules. So it would be really hard to put together like a single page sheet for every single exception for every single city that may change every single month. So it makes it a little challenging, but I'm sure we can give you something for Cal OSHA and something relating to the ETS. But it may not be all inclusive. And that's why we really haven't put something like that to that extent together.
Got it.
If that makes sense.
Yep.
But to Janice's point, Deborah, and everybody will be getting a copy of this presentation, by the way. So going back to what I was saying earlier, in the actual presentation that we went through today, there is a couple of slides on there that allow you to have that decision flow process, that decision process. So, it says in there for vaccinated employees, this is what you can do. These are the requirements, and for unvaccinated employees, these are the requirements. So in your presentation, you'll actually see it in there. And if we have something additional to that, we'll go ahead and provide that to you as well. Okay, does that help?
Yep, thank you.
Yeah. So it is actually in the presentation that we went through as far as vaccinated and unvaccinated return to work criteria and notification procedures. Okay. The other thing I think we'll do is we'll actually send a link to the regulation itself. And again, it's CCR, California Code of Regulations 3205. For those of you who love some night reading and want to fall asleep or need to fall asleep, reading Cal OSHA regulations really does a trick. So if you really want to look at the regulation specifically, we'll send you a link. And we also actually have just I put it on a Word document. And I actually made it where I highlighted the various elements. So we'll send that out to you as well. Okay. Okay.
I guess we're at the top of the hour.
Yeah.
I don't have any other questions in the chat room. Does anybody else have any other questions?
I'll finish with this, folks. As you think about questions, go ahead and put in the chat. Keep in mind that the new administration, as you all may be aware, has also just instituted a federal ETS, emergency temporary standard, that came about last month. What that directive is to ensure that employers with 100 or more people, right, require vaccination of employees. That was signed and put in effect by the Biden administration, and execution and implementation of that federal ETS is being given to OSHA. So just as of a week and a half ago, OSHA drafted the ETS to be approved, and what most likely will happen is once it goes through the approval process, it might take a few weeks to get that in, and once the federal OSHA ETS is promulgated, then the states who have a state OSHA plan, such as Cal OSHA, such as Washington, then they have 30 days to execute a federal OSHA mandate. Because again, remember, we have a state plan. We're in California, so Cal OSHA, whenever there's a federal mandate or federal OSHA regulation that comes out, or it's emergency regulation, right? The states that have a state OSHA plan have 30 days to ensure promulgation as well. We are totally on top of this. Our corporate risk management team, our HRCs, our RMCs, and we're following this diligently. So once this comes about, we will go ahead and notify everybody of the ETS and when they're looking at instituting this. But that's really what the emergency temporary standard is requiring vaccination with employers of 100 or more people. Yeah.
Okay. All right, everybody, thanks for attending. As I said earlier, I think Janice is going to send out some material after this training, a copy of the presentation and more resources on this. But as Rob was saying earlier, if you guys have any questions, feel free to reach out to your risk management consultant, and we can help you with anything that you have on the new standards. So thanks everybody for attending.
Thanks everyone. Have a great day.